think we can start. So good morning to everyone, and welcome to our PDW on very long title, Artificial Intelligence, Healthcare and the Changing Nature of Organization and Professional Work. Welcome to our panelists and welcome to our participants here in Seattle and both online that are joining us from different countries. And thanks also specifically to the sponsor division. So first and foremost, to the Communication, Digital Technology and Organization Division, Healthcare Management and Organization and Management Theory divisions. So my name is Giulia Cappellaro. I'm Assistant Professor in Public Management at Bocconi University, and I'm joined here today by Angela Aristidu, Assistant Professor in Strategy and Entrepreneurship at University College London, and by Natalia Levina, Professor of Information System at New York University. So let me just very briefly start with the reason why we thought about the importance of this PDW. We think it's, so far recognized that AI technologies have somehow the potential to deeply affect work and organization by reshaping organizational boundaries, transforming expertise and knowledge work, and also altering some of the coordination and control mechanisms. But somehow the real world consequences of such interaction needs to be more fully researched. And this is because, as some of us, also our colleagues here have recently written, some of these AI tool implementation really suffer from the deployment problem, with few systems really moving beyond the experimental stage. So the aim of our PDW today is really to try to tackle some of these questions. Basically, how do we as management scholars grapple with studying AI in healthcare, and also how can we meaningfully study the effects of AI implementation in organizations. So through some of our research conversation that we had, we came to realize that there is really a need to share knowledge across, occupational and community boundaries beyond, information systems, healthcare management and policy and organization theory. And this is really our purpose today. So we are happy to see that there is an audience that really reflects such interdisciplinary background. But first and foremost, we also try to invite colleagues whom we, whose work really talk to this conversation. So let me very briefly, introduce our panelists today. So Batya Mission-Wiesenfeld is Andrew Q. Professor of Management at NYU Stern School of Business. She is definitely an expert in organizational change, and her work really consider issues related to inclusive digital health technologies, employee empowerment, and the mindful use of technology. Michael Barrett is Professor in Information and System and Innovation Studies at Cambridge Judge Business School. Michael research focuses on digital innovation with a specific interest on AI, telemedicine, and digital twins are enabling new models of care. Becky Karp is Assistant Professor at Harvard Business School in the Strategy Unit, and Becky research focusing on how digital technologies can really transform organizational work and how healthcare organizations can reshape somehow the innovative direction of AI and digital technologies as they really, put this technology into practice and into implementation. Samir Faraj is a professor at McGill University Desol's Faculty of Management, and he studies complex collaboration and coordination in healthcare, and also how healthcare technologies are transforming coordination, allowing also new modes and forms of organizing to emerge. And Stella Pachidi is Assistant Professor in Information System at Cambridge Judge Business School, and she studied the introduction of artificial intelligence technologies in organizations, managing the challenges in the workplace during digital transformations, and study practices of knowledge collaboration also across boundaries. So we will learn more about your work in a few minutes directly from you, but let me just introduce the reasons why we think it's important to focus on AI and healthcare and to study the changing nature of organizational work. I will just very briefly introduce on why we think healthcare is important, and then we'll leave the floor to Angela for the more AI and digital technologies part. So let me just say that, healthcare is considered one of the key sectors in which AI will have the greatest impact in the future and in professional judgments, as, data-driven tools for diagnostic, for treatment, for management are rapidly developed. Is a significant sector in the economy, roughly, as you know, counts for 10% on average of the GDP of developed countries, and has seen the past years really few massive investments in AI. And as the empirical evidence is accumulating, we need to reflect on how really, what are the distinctive features of AI that can contribute to advance the study of the changing nature of organizations and professional work. And we think there are a few directions we would like to pose here, but there are many others that we would like to discuss. The first is that obviously, technological implementation does not happen in a vacuum, an institutional vacuum, and specifically healthcare systems are mature fields where the introduction of new technologies are typically, for the implementation part, subject to nationally or supranational regulatory procedure. And hence, it might be interesting to, to use healthcare to contribute to the study of the macro, micro, so the multi-level mechanisms that are associated with the implementation and the scaling up of AI technologies. And also, and this is a theme for the Academy of this year, the relationship between governments or regulatory agencies and professionals. Second, the implementation of medical AI technologies typically require the active role of different actors. So not just from the AI developers, but to physicians and to clinical end users, to patients. And hence, I think, we are in the best place to try to theorize more also the strategies of multi-stakeholder engagement and co-creation. Third, from what we can see, in emerging regulatory frameworks that have been, proposed recently, I'm just thinking about the recent EU Commission for the Regulation of AI in last year. Medical technologies tend to be classified as high risk in terms of, or according to the severity of harm they may induce, and also to the probability and frequency of such harm. So this really brings the question theoretically about, the role of governance, of ethics, of accountability. So healthcare can really be an extreme case to study these dynamics, both at the level of individual professionals, so tasks, routines, but also at the level of system of professions. Think about, changes in codes of practices. And finally, I mean, this might be something for the future, but obviously when we think about healthcare organizations, AI technologies include really the heterogeneous classes of tool or technologies, more from the clinical practice side to the health administration side to the more, public health technologies. And hence in the future, it might be interesting really to use and study the healthcare sector to understand synergies between classes of AI technologies and how this might, contribute to the development of novel organizational capacities. So this is for the healthcare part, but, I will now leave the floor to Angela to understand really the AI contribution.